Hello, my name is James Gonzalez, and this is my podcast, James Laid Out, and this is my guest, Gigi. She's an RN.
Hi, yes. I'm Gigi. I've been doing nursing. I've been a registered nurse for about 15 years, going on 16 years already. I worked a little bit of everything from hospitals, med-surg, labor and delivery, to nursing homes, wound care specialist, and now I'm going a little into the aesthetic field. But I'm still in both. I haven't left my full-time job yet. I'm transitioning and going part-time, but I've done a little of everything.
And I think, like, with all those different areas, what population group has the most complications?
Population group?
Or not population, what disease is, like, overall, like, damaging every population group?
I feel like diabetics.
And I've noticed with diabetics, like, they'll take their medication, they'll do everything their doctor does. Their blood sugar's in control, but they're still having this complication. And I think it's that El Paso thing, like, I take my medicine, why am I still getting sick?
Right.
And I think, like, people don't understand, like, just because you're taking the medicine and everything's good, doesn't mean nothing bad can happen. It means, like, you need to correct something.
Right.
Because there's a reason why you're a type 2 diabetic.
And I think being a wound treatment nurse, I would see a lot of patients struggling, with their wounds, especially on their feet. Healing, they weren't healing, even though they're controlled, but maybe sometimes they are affected by their weight as well. And there's a lot of other triggers, and we would have a lot of hard time with their wounds. They weren't healing at all. So I feel like preventative, like medication, has really helped the clients a lot. Instead of getting to their worst point, right? It's difficult. It's difficult for them.
Yeah, I think preventative medicine is, like, it's more important than regular medicine. And I think, like, that there's a lot of people out there that are mad about Manjaro, Ozempic, and that they're being supposedly taking from type 2 diabetics, but it's like, they're just preventing them from becoming that type 2 diabetic. I think it's just, the sooner we start controlling this, the less complications that person will have in life. And people don't understand that someone who is gaining weight, they're hyperinsulinemia, and that disease is just not diagnosed yet. And we don't talk about it, and that's why all these problems are going on.
Yeah, I feel that there's a misconception about using these medications. And yes, people say a lot, they're taking away from diabetics, but I feel that it's more important for us to educate our clients, our patients, on what it truly does, how it truly helps, and use it more as a preventative to prevent those diseases, prevent heart disease, prevent liver disease, prevent diabetes, rather than using the medication once you already have it. And you're dealing with other complications, you can't control it. It gets to a point where, for example, my dad, he's been a diabetic for several years. I think I was 3 years old when he had his first heart attack. And he's been a diabetic, dealing with hypertension, all kinds of heart disease, high cholesterol, and he's been on insulin for a very, very long time. He was to the point where he was using about 90 units of insulin, injecting fast-acting insulin 3 times a day before his meals as well. And he was so uncontrolled for many years. I mean, you're talking already, he's 73, and he got his heart attack at 40. So they started him on Manjaro, but because that was the last resort. He's been dealing with it for so long, and as a last resort, they started him on Manjaro. Now, yes, of course, right now, he's doing very well. He's lost weight. He's off of insulin. He doesn't require insulin no more from taking almost 90 units, no insulin whatsoever. But it's been difficult. It's been difficult for him. But my point is that why get to that point, right? Why get to that point where you're requiring so much insulin when right now maybe you can prevent it and use it as a preventive medication?
And I that's why I really see, like, that new trend, and I think the anti-aging market is really just preventative medicine. And like I like with nursing, it's just like, it just seems like there's more and more work. Like, You know, we have to do more documentation, and we have to be like, I did this so that, and we have to write it a correct way so that way it gets billed correctly, or else we don't get paid. And I think with that with anti-aging market, it's preventative. We're able to do things because the client wants it, and we're able to catch things a little bit faster. And we don't have to be like, oh, I can't bill for this, so we can't help you. You know, it's like, and I think that's the new nursing. That's a new venture in nursing. I'm really pumped about this anti-aging market because we can help people, and I think you became a nurse to help people. I became a nurse so I can help people. I'm tired of like seeing people in ICU with something that could have been preventative.
Yes, and I love what I do. I love helping people. I love educating. I love teaching them. And I've been a home health nurse already for about 8 years, ever since I moved here to El Paso. And home health involves a lot of education. But then you are right. I feel that hospitals, home health, anything in nursing right now, I feel that nurses are being overworked. And particular in home health, I feel that they're being burnt out because now insurances require so much documentation. And yes, I feel like we need to have clear what the patient needs and their necessity, but we spend more time documenting than with the educating the actual patient. So we get so busy sometimes in the home health that we have a full load. I mean, and we struggle with all kinds of things, traffic, weather. You never know what you're going to encounter when you walk into the patient's home, and maybe we spend an hour there, and you still have another hour to an hour and a half of documentation. And this is per patient. So I feel like the nurses are getting burned out really quick. And it's just difficult how it just switched, right? Now we're focused more on the documentation and showing the need for the patient than sometimes the actual care that we're providing, which is one of the things that I feel that's why as well I got burned out. I love bedside. I love taking care of my patients hands-on, but that's one of the things that I loved about aesthetics work as well, that it's a very happy field. I feel that you're able to educate more like on your clients when they come in. You don't have that limited time that you have to crunch because you don't have that extra documentation that you have to do for insurances. We don't have that. You know, we have to show our work and we always have to cover ourselves, but it doesn't work like that. We don't have to deal with that aspect of insurances, so we're able to dedicate that time to our patients at 100%, give them realistic goals and create a plan for them. And I feel that that's one of the things that I fell in love with.
You know, so what kind of anti-aging therapies are you on yourself?
On myself?
Mm-hmm.
So, I mean, yes, I started getting Botox when, like, early 30s. I'm 37 right now. So I would say about 30, 32, I started looking into it. And it's funny because I started looking at injectors here in El Paso, right? Who am I going to go with? Started looking. And of course, my husband was the first one to say, oh no, completely against it. You don't need it. Why? You're still young. You don't need that. That's for older women. Like, you don't need it. You're crazy. And, but obviously, I mean, I've always taken care of myself as best as I can with, you know, facials, creams, day, night creams. But I started noticing that I needed some treatment, and I wanted to get it, but he was holding me back. My husband was holding me back for a while, until I kind of had to put my foot down, and I told him, you know what, like, I'm gonna do it. It's my face, it's my money. I'm gonna do it. And he told me, well, if you do it, don't come back to me crying. You know, I don't know what's going to happen to you, how they're going to leave you, but if something goes wrong, don't come back to me crying. But I did my work. I did my, you know, I researched. I knew exactly what I wanted. And so I started with that. I started with a little bit of the Botox. And then right now what I'm doing is weight loss medication. I'm on Manjaro. I've had a hard journey with weight loss. So I've been diagnosed with hypothyroidism. It started about 12 years ago. So I was fairly young, and that was one of the reasons why I couldn't get pregnant. So I couldn't get pregnant. I didn't know why. I didn't think I was gonna struggle at the time, but finally they realized that it was my thyroid issues. My hormones were extremely low. I wasn't ovulating. I wasn't able to get pregnant. That's how I started. Then I went into a period where I did suffer from some depression. When I moved from my hometown, leaving my parents, my family, everyone behind, and I moved here to El Paso, I kind of dipped into a depression. Since I had no family here, my husband and I, prior to that as well, we were struggling. We were about to get a divorce. We had been separated for about a year. And we moved here trying to just, rebuild, right? Try to save our marriage. So all that was very, very difficult for me. And it kind of took me into a depression without knowing. I feel nurses are the worst patients, right?
True.
We are. So it took me a while to realize my symptoms. And until finally just having a conversation with my doctor, I realized, and he's like, yeah, you are depressed. You have many reasons to be depressed, but they put me on an antidepressant. And that antidepressant, I felt like it made me very hungry. I was constantly thinking about food. Now I developed another disease, I think. I tell him something's wrong with me. I'm constantly just thinking about food. I would be eating and I was already thinking of what I was going to be eating next. I was hungry all the time. And that very quickly, in a matter of a month, 2 months, I had already gained 20 pounds. So now, again, my thyroid issue made me gain weight because I have hypo, and then my depression with the antidepressant medication made me gain another 20 pounds, and then from there I was just stuck, unable to lose weight. So I did seek more help. I went to a thyroid specialist, and they tried to switch me from being hypo to now being hyper, right? Having some hyperthyroidism just to kind of make me see if I would lose some weight. They adjusted my medication as well as my antidepressant. That was adjusted, and I feel that with the help of the medication, that's helped me lose some weight. So right now, I would say that in a matter of like 3 months, I've lost about 20 pounds, which are the ones that I've gained with the medication. So that's where I'm at right now. It's not easy. It's not easy to be in a diet. But I feel like Manjaro, what it does is that it helps you kind of stop that noise that you have in your head, right? Sometimes we have that noise about food. When we try to do it on our own, we have a very hard time. I mean, I've tried it many times, and it's hard, right? To be consistent with your diet plan and be strict with what you're eating. And I feel that the medication just kind of helps you. It does decrease your appetite for sure. You don't feel hungry, but it stops that noise in your head about food or cravings. It stops cravings completely.
What is the biggest side effects you've seen with Manjaro?
With Manjaro, for me, it's the GI stuff. I get very nauseous. I get morning sickness in the mornings. I do have some morning sickness. It's like I'm pregnant all over again. But more than anything, I feel that it's more if I go into eating something fatty or buying fast food on the days when the medication sits at its strongest point, which I feel are like the first 3 days. If I eat something bad or fatty those 3 days, for sure I'm going to be vomiting or having some diarrhea or something like that. It's going to happen for me. As well, you do kind of feel like low energy. I feel like I'm low energy with the medication.
So I think like Manjaro, I think it's not for everyone. I think it's not for someone who wants to get more in shape. I think it's more someone who's just struggling with the eating aspect of if you're struggling controlling your appetite, then I think Manjaro is great. But I think for someone who's real active and trying to like say prep for a competition or something,
Yeah.
it may not be that medication.
Yeah, no, I feel that it's not the medication. It truly does make you feel low energy. It's hard to get up and go about your day, go to work, and then still want to be at the gym working out. I feel that it doesn't work like that. But definitely for people that have been really struggling, maybe like myself, or that are their BMI is more than 25, people that are really need to lose some weight, it can really help just give them that push.
My
As
BMI
far
is
as
29. My BMI is 29.
29,
Mhm.
really? So when we're on this medication, yeah, they usually require for the BMI to be at least a 25.
See
if
that-
not, you won't be a candidate for the medication.
Well, I'm just saying my BMI is 29, so but I think that's one part way of looking at it, but I also think another way of looking at if you're a candidate, it would be like waist to hip ratio.
Right.
Because I think a lot of people look as a BMI as an indicator of health, and I really can't lose much weight anymore. Like, I mean, I can lose some. I really can't lose much fat. I can lose muscle, but like muscle is it's the longevity organ. Like, I don't want to lose that. So, but
And I feel that's something more like you are correct. I totally agree, but it's something more like doctors. In the medical field, that's the first thing they look at, right? They have to go to the BMI, but that's the first thing whenever I get a client in that they want to know
Yeah.
what is it, and we do have to do a good faith exam. So whenever they come in, that we get their height, their weight, their past medical history. One of the things is that their BMI has to be at least 25.
yeah, I mean, I think it's a good start off point. I just think some people just because their BMI is 25, above 25, may have more problems than
May have
others.
more problems,
And
right?
I think like, I think Manjaro is a great thing. It's a good stepping stone because so many people in El Paso struggle with diabetes, and it just seems to be just getting worse and worse every year. And I think we need to tackle it any way possible. And Manjaro might be the right way to do it for some of these people. And I think it'll save more lives, and I think it's kind of sucks that some people have to go through, like they have to do private pay, and they pay out of pocket, and the insurance doesn't pay for it.
Right.
When they're trying to get healthier, which sucks.
Yeah.
Because they're really gonna save their own insurance company money because they're just taking care of their
Taking care of
diabetes
themselves,
before us.
trying
And
to prevent them from actually getting diabetes or.
and diabetes is an expensive disease to have,
It is.
It has so many complications, dialysis, heart failure, stroke, so many things, and so I think it's just, it has its place in the medical system. But I think what you're saying is like, when you're on this kind of medication, you really need to eat you have to change your diet. You
Yeah.
can't stay on that same diet you were on because you're not eating. So what you're eating, you almost have to be twice as observant as
Right.
with your food.
Mhm.
So
yeah, it's definitely something that's life changing. It's a lifestyle. I feel it's not something that you can just do and try to eat more nutritious just while you're on the medication. You have to think about it as a life changing thing, right? It's gonna be long term. Maybe while you are on the medication, you're on your journey to lose weight, that's the opportunity for you to get used to this lifestyle, right? And I know that right now, even groceries, right? Everything that's more healthy, it's more expensive. So I know it gets difficult and it gets pretty pricey pretty fast for some people. But I mean, we definitely have to do something about it, and I feel like educating and teaching our clients is a good way to start.
yeah, and I think it's just really great how, the anti-aging market opened this preventative, like you said, you expected to do Botox, and now your biggest seller is Manjaro.
It's Manjaro.
And
weight
so I think that's just so much better for El Paso, and and it can do amazing things, and that's why I love how this market's going, and I'm
Right.
proud to be going into this so I could actually help people more.
loss. So yeah, I'm trying to get healthier myself. I know that another injection that's very popular, it's the NAD.
Okay. I haven't tried the NAD, but
anti-aging.
I haven't tried the NAD, but can you just go over some like how it works and all that stuff?
So the NAG, it's called the anti-aging. What it does, it's something that it's reproduced by your DNA, right? And usually people that are usually starting in their 30s, they start seeing less of those cells, right? That keep us healthy, that keep us energized, that keep us looking young. So we start losing those from 30 years and on. And when we use this medication, it's kind of like we're just replacing, right, those cells for our in our DNA. So usually it's paired up with our mitochondria, and it helps reproduce those cells. So it's very popular because it helps a lot of your mental status. It does give you that energy boost, but it's good for those people that are suffering from like insomnia, that have a lot of stress in their life, that have depression, anxiety. It gives you that stability. It just gives you that mental clarity that you need to just kind of feel healthy.
And I think that makes a lot of sense what you're saying. I think when a lot of people eat a lot of sugar and a lot of carbs and all that stuff, and basically those carbs and sugar are really bad for the mitochondria. So I think that's why NAD works so well, and maybe paired well with someone who is on that verge of becoming diabetic. Because I've noticed when people are, before they become diabetic, they're like, I don't have energy to work out.
Right.
And it's because, what is the mitochondria? It's the powerhouse of the cell. That's where you get your ATP, where you get your energy. So, but when you have a lot of sugar, you burn out your mitochondria. So NAD might be the reason on helping that person get back on track, but understanding that high carb diet is what's destroying the mitochondria. But it's kind of like they're already did damage to the body, so we need to get past. The damage is done. We need to fix it so they can live a better, healthy life.
Right.
So.
And again, it goes back to changing your lifestyle and making some life-changing choices, so that ultimately you feel better.
Yeah, and I think you brought up some really good remarks. I really had a good talk. Anything you would like to close off with?
No, I just feel that we are on the right path. I love what I do. Like I said, I still want to continue helping people, educating them, and I want them to know that we're in this together, right? We all have our struggles, and I know that it's a big struggle to get healthier, to look better, to lift up your self-esteem, your morale. But ultimately, we're here to help, and hopefully they can see that, and I can reach out to people and help them as much as possible.
And your Instagram is what?
Gigi, nurse injector.
Okay, cool. Thank you.
Yes.
Well, thank you guys.